Hi, this presentation will look at the measles out will look at a measles outbreak and try to understand it from an infection control point of view. We'll start off with trying to explain the measles virus, infection control that we can do around the measles virus in the international and the New Zealand context. And finally, we will look at um, the measles virus in terms of the Treaty of Waitangi and Te Whare Te Pawhā, which is a Maori health model. To start off, let's talk about the measles virus. So the measles virus, according to Boades, is a single strain RNA virus from the genus Mobilovirae. The family is Paramidoxoviridae, and the mumps virus and RSV virus come from the same family of highly infectious diseases. The measles virus is a very stable virus genetically, which means it is less likely to mutate. Although, being a virus, it can and does mutate. So, there are some genetic variations to this virus. This information has been used by epidemiologists quite well, and I will show you up ahead how. So, the measles virus, according to the CDC, is one of the most infectious and contagious viruses of all the infectious diseases reported. It is so infectious that 9 in 10 people who come in contact with one infected person will go on to develop measles. Measles is spread through direct contact with the infectious droplets, which can be airborne when an infected person breathes, coughs, sneezes, or even talks. It can remain infectious in the air for up to 2 hours after the infected person has left the area. Some signs and symptoms of the measles virus, according to Habushan, are that the measles virus can start causing symptoms 4 to 6 days after exposure. Milder symptoms, which may look like a minor cold, are more common in people who are vaccinated. Classic symptoms of measles are fever, rash, cough, and sneezing, and it is the cough and sneezing bit which is the infectious area. Other symptoms of measles include conjunctivitis and diarrhea. Diarrhea is of special note because people with measles can become really unwell with dehydration caused by diarrhea. Severe or fatal symptoms of measles include pneumonia and encephalomyelitis, which is the inflammation of the brain and spinal membrane, which in most cases is fatal. Let's look at some factors contributing to measles outbreaks world over. The World Health Organization describes measles as an infectious disease, but a disease without a cure. The people who are most at risk of measles are unvaccinated young children under the age of 5, unvaccinated pregnant women, unvaccinated general populations, and immunocompromised individuals. How is measles managed then? Fabishan describes measles as a highly contagious, potentially fatal, but a vaccine preventable disease. Mulchandani reports that the 2-dose MMR vaccine remains the most effective way to prevent measles. The World Health Organization sees vaccine as the cornerstone of measles prevention. Pre vaccine, measles caused more than 2 million deaths globally. In 2018, approximately 140,000 people died from the measles virus globally. 140,000 is still a very large number, but compared to 2 million, it is definitely less. What other infection control principles can we use to manage measles? Here, it's about breaking the chain of infection. So the infectious agent is the measles virus, which we know is very highly infectious, and the reservoir is the person who has got the virus. When they cough or sneeze, the droplets leave their mouth and go into the air, where they stay until someone else breathes the virus in through their nose and mouth, and then that person becomes infected, and then they become unwell with the virus. As with any other infectious disease, breaking the chain of infection is essential. So we need to identify, isolate, and eliminate. Now, I'm not talking about the COVID-19 virus, but this principle is still very true for the measles virus, just because, like COVID 19, it is highly infectious. Hungerford reports that the transmission of measles can be reduced with increased awareness, that people can identify measles in the first instance, rapid testing, early isolation, contact tracing, and implementation of infection control measures, including the correct use of the correct PPE, airborne precautions, hand hygiene, and promoting vaccination. We are not talking, again, we're not talking about the COVID-19 vaccine. We are talking about measles. And again, these same principles are very, very true for measles. Paria states that Spain, which was declared measles free in 2014 with high vaccination coverage, still gets imported cases, because of which mask wearing and social distancing is used to promote immunity in healthcare workers who are at high risk of getting measles from imported cases. Furthermore, ASME states that research in the US showed that although vaccination remains the primary factor in measles prevention, in their research, compartmentalizing students, enhancing building ventilation, and air filtration had a positive effect on reducing measles transmission. After all, measles is an airborne disease. Now let's have a look at this in the New Zealand context. According to Turner, New Zealand was declared measles free in 2017. There have been a few measles outbreaks, most notably in 2014 and 2019. And today we will look at the 2019 outbreak, when there were 1,500 confirmed cases in the North and South Island of New Zealand. Of the 20 DHBs, 16 DHBs had confirmed cases of measles, and a third of the people needed to be hospitalized. However, no deaths were recorded. So, we may ask that New Zealand was declared measles free. Where did this measles come from then? Williams reports that imported cases and suboptimal vaccine coverage attribute to the 2019 and will contribute to further outbreaks of the measles virus in New Zealand. The numbers in New Zealand tell another story. The World Health Organization states that herd immunity is achieved when 95% of the population is fully vaccinated against any virus. According to Hyman, New Zealand's vaccination rate is between 80 to 90% only. And it is this suboptimal coverage which is a big risk factor for future outbreaks. In the 2019 outbreak, a majority of the cases were in young infants under 2, teenagers, and young adults under the age of 30. Let's now move on and look at other principles of in measles outbreak, and let's look at the role that the MMR vaccine has to play in this. So measles is described as a disease without a cure, but it is a disease with a vaccine, the MMR vaccine. The World Health Organization states that 140,000 people died from measles in 2018, a good percentage of which were unvaccinated children under the age of 5 who lived in developing countries and low-income countries like Africa and Asia, with weak healthcare systems and even weaker immunization programs. The MMR vaccine plays an important role in preventing measles infections, and its role in measles prevention cannot be emphasized enough. At least 1.8 million measles related deaths are prevented globally through the use of the MMR vaccine every year. Singapore, which has eliminated the measles virus, did it through achieving herd immunity at 95%. New Zealand and the United States, for example, on the other hand, have eliminated the virus, but their outbreaks are most related to low vaccine rates among very at-risk populations. Now we have talked about vaccination as an infection control method. Now let's look at surveillance, which is very important. So, in terms of surveillance, it is essential if we want to eliminate measles. The World Health Organization has a measles surveillance program which emphasizes on case reporting, laboratory testing, investigating suspected cases, investigating epidemiology and characteristics of the measles virus in any outbreak. Let's also look at surveillance and the MMR vaccine. So, Vidya in 2020 stated that during genome sequencing of surveillance testing in India from 2009 to 2017, it indicated that the currently used MMR vaccine, which has been in use for about 60 years now, remains the most effective way of preventing measles today. This could be due to the earlier discussion about the genetic stability of the measles virus, that the virus is does not have too many mutations, and the vaccine continues to be a really effective way of treating the virus. In New Zealand, measles is a notifiable disease to the Ministry of Health, who report it to the World Health Organization, and it is surveillance for measles is done in two instances. First, by the Ministry for Health at a national level, then the World Health Organization at a global level. Let's now briefly look at the Treaty of Waitangi and the Maori health model Te Whare Tapawha in terms of a measles outbreak. Turner stated that in the 2019 measles outbreak, approximately 40% of people who were hospitalized were Maori. Lower vaccination rates among Maori, who are also more likely to live in insecure and overcrowded housing, makes them a target for an infectious disease like measles. Maori in New Zealand also suffer from more socio-economic deprivation, are less likely to seek healthcare, and have greater distrust in the healthcare system, which they see as foreign. The Treaty of Waitangi ensured that Maori received special protection as the Tangata Whenua, or the people of the land. However, this protection has not transferred into reality. Te Pare Tapawha incorporates spiritual, physical, family, and mental health as the four corners of the house, which ensure that the house of Whare is healthy. Due to the nature of the measles outbreak and the socio-economic determinants of health, like income and education, which is a further stack against Maori. They do not do as well as other ethnicities during times of disease outbreak, be it measles or COVID 19. The responsibility lies with the government of the day that Maori be better protected and served in terms of greater health needs, for example, in epidemics and pandemics. In conclusion, I'd like to say that the measles virus, although highly contagious and it does not have a cure, can be prevented by using the MMR vaccine. The two-dose MMR vaccine has been shown to globally reduce fatality related to measles. Also, measles outbreak, measles needs to be identified correctly in the first instance. The people who are positive to it needs to be isolated and then given care so they recover, but they do not pass the infection on to somebody else. How measles is treated is quite similar to how COVID 19 is treated, that we use PPE, we socially distance, we clean our hands frequently, we wear masks, we use airborne precautions. So these things also come into play. In terms of infection control, prevention, and strategies, vaccination remains the cornerstone of measles prevention. Also, surveillance is very important. So, the World Health Organization, ministries for health world over know if a measles outbreak can and will happen, especially due to low vaccination rates globally. Also, in terms of the Maori health model and the Treaty of Waitangi, measles is another great example where Maori have been failed by consecutive governments, that their special health needs are not taken into account, and it hasn't been catered for, which leaves them at a greater disadvantage, especially in cases of outbreaks and epidemics. Thank you very much for watching.